through emails? How do we provide a more seamless lead capture and appointment scheduling? How do we make sure this can be shared with the backend EHR platform for a quick, without having to have any manual need for creating a patient chart? How can systems talk to each other using technology? So a lot of these different areas primarily go into dividing what would be done on a CRM and what its capabilities are versus what it does. I mean, what do you do on an EHR platform? If you look at the next slide, you'll see how a CRM can be well integrated with different platforms, different solutions to bring about that end-to-end one single experience. You will be able to integrate it with your EHR, EMR platforms. You can integrate with billing systems. You can integrate it with marketing tools and practice management software, a patient management system, right? There is so much that you can do, which is everything that's operational, marketing, or non-clinical that can be taken care of in the CRM platform in today's day and age, versus instead of cluttering your EHR with a lot of these non-needed, non-clinical medical information in there. So that keeps your EHR very, very clean. So when doctors go in, they know exactly what they're looking at. They know what they need to do when it comes to the patient's treatment, what they're prescribing, what are the next steps, and so on and so forth. So it becomes very, very easy for the patient experience as well, and for patient outcomes as well. So with that, I'm going to pass this on to John to take this discussion ahead. But before we do that, one thing that I do definitely want to do is I would want to know a little bit more about everybody who's joined us on the call today. Please tell us where you are from, what organization, what do you do? It will help us in understanding the different backgrounds that we have on the call today. And we'll try to make sure that we talk about those different avenues that might be most relatable to you and how it can be tied to this conversation as well. So please let us know your organization, what do you do there, and ways that, you know, what are you expecting from this discussion today. Over to you, John.
All right, thanks, Nick. So as people are maybe dropping some comments and letting us know where they're from and the organization they're with, we're going to do our first poll, which basically just want to get a sense for everybody that's on the call, everyone that's attending. Do you currently use a CRM system to manage leads? So that will kind of, again, help us tailor the conversation a little bit. Okay, so as we're having our attendees vote on that poll and give us a little bit more information, we want to kind of start off our conversation with our panelists and talk a little bit about what some of those limitations and issues are that our panelists are seeing or have seen in the past with organizations that are too reliant on an EHR or only have an EHR and not a CRM. So why don't we start off with John? Do you want to talk to us first?
Sure, be more than happy to. So, you know, as I expressed with my experience being in several different parts of the healthcare spectrum, what I've found is most EHRs were either designed, one, strictly for that patient documentation that Nick was talking about, you know, truly HIPAA-related information, visit notes, you know, the care that's being provided for the patient, referrals for medications, different things like that has to be protected. And the other, if you've got a really good system, it is also generally good for billing. But otherwise, a lot of the functions that now EHR vendors are trying to add on their CRM systems and different things aren't nearly robust enough to help an organization to manage all the different data elements that Nick had just referenced about. How do you nurture patients? What patients are actually calling you? How many patients do you turn away? How long does it take you to get from, you know, an initial phone call to an admission of a patient into your system, right? Does that take months? Does that take weeks? Does it take hours? What does it take? Also, the question of what business are you turning away when people call? What are you tracking do people call and say, hey, I want something in this adjacent type business, and your advertising kind of leads me to believe that you may, provide that service, and tracking that type of information helps you to specialize your marketing and your focus in those areas, so that you're truly getting the market niche that you're providing, and you're able to get those patients into care, caring for them, generating revenue, building and growing your business, versus those things ending up on Post-it notes that have to be manually looked at, if ever at all, and integrated into your practice management. What your organization is trying to focus on with those growth avenues.
Yeah, I love that. I love that you talked about all those manual actions and things that have to happen. I feel like that will be kind of a theme of our conversation today, and has a lot to do, we'll talk in a little bit, but sometimes just because you have a CRM, if it's not set up in the right way, right, it's not configured in the right way, or it's not integrated in the right way, you still may be doing a lot of those things manually that you don't have to. So, Charles, talk to us a little bit too about some of the challenge that you've seen. I know you said you've done a couple enterprise like EHR integrations in the past. What are some of those common things that you've seen?
So, well, the common thing you see is that there's no follow-up and communications capability. The CRM really allows you to do the follow-up, right? How many times do you give patients instructions that they throw in the garbage, or they get lost, right? And they don't follow up, and they end up on readmission. The CRM gives us the capacity to truly build conversations and build profiles on patients that we can customize to be our voice of communication between them and their EHR. Right? The EHR is all this data that they have in a system that's of no benefit to them unless it's in front of them. You can build dashboards. We build patient journeys with CRMs to say, listen, here's the reminders, or here's the milestones you're going to meet in getting over your heart failure or your cardiac rehab. So there's a ton and plethora of things that you can do with that CRM that you're not able to do with the EHR. Because the biggest challenge is being able to get them to, even if a patient had access to everything in their EMR, it's not in a context that they would understand it all the time, right? If I gave you an MRA, and you went through it and read it, and you'd go, oh my God, I'm dying, and half of the findings may be normal, right?
Right.
That CRM gives someone the ability to analyze the data and transform it into information, and then push it to the patient where it's of their, they can apply it and use it as a benefit.
Great. So let's do our second poll really quickly, because we also want to hear from some of the folks here that are attending what some of those common limitations or issues that they feel like they have with their EHR system. And, I want to talk about one of those things, right, which is, you mentioned communication, Charles, and I feel like that is one of the biggest things you miss. And from a data perspective, I'm kind of coming at this from more of a marketing and patient acquisition perspective. But one of the really common issues that we see, especially now, is that a lot of data, potentially, medical data, medical history data, or, that kind of data is shared now as a part of that new patient lead process. And these are things that, if you're completely reliant on an EHR, you have no visibility into that data, until someone becomes a patient. And it's a challenge, right? And I know John mentioned as well, like, how do you know what you're turning away, right? Or, the leads that aren't converting into patients, like, how do you understand, like, what commonalities are between them? So data has always been, I think, one of the big limitations that I see with not having a CRM, that's maybe a little bit more applicable to marketing. But it looks like in the poll, issues with data, outdated, incorrect information is big. Lack of interoperability is a huge one. I know we talked about that a little bit in terms of integrations, but anything, Charles or John, that you'd want to talk about specifically related to interoperability?
Interoperability is the biggest challenge we all face, is knowing, treating, for example, in emergency rooms, patients show up, they have a chief complaint, right? I know nothing about the patient's history, right? Patient might have a history of renal failure, heart disease, whatever. But in many cases, the treatment that we give them will harm them if I don't have a history. Interoperability, me having access to other records, me having access to understand who the patients are, because care has to be patient-centric. Now, it doesn't mean that the institution intentionally did it, but it occurred and events occur. And that's what's causing the liability to be so heavy on hospitals, is that they treating patients that they don't know. So me having access to that information is pivotal in me being able to customize the treatment and interventions that we give in order to save people's lives, because people are losing their life every day over not having information available.
Yeah, I agree with you, Charles. And I referenced earlier that, a lot of the EHR systems are now trying to build on pieces like CRM, like BI tools, analytics tools that allow you to pull all that data together. The problem is that, they tend to not, until you get into someone like an Epic that's large enough to have full departments that build out each module, each unit. If it's just their EHR development team that's trying to develop a CRM and they don't fully understand all that needs to be tracked and trended or even reported on, you can enter all that data, but if you don't have a system that you can get it out of, it's no more useful than it is to never have had it. And so the EHRs that I've dealt with that have built their own CRM tools have been wildly just underperforming in multiple ways. I mean, when you're out doing marketing, and John can tell us all about this with his experience, nowadays it's not just the flyers that you hand out. Most businesses have boots on the ground salespeople that they have to track and monitor certain ways. Who are their accounts? Who are they talking to? How often? What is that driving and generating in sales performance? You've got marketing materials that you do and advertising in newspapers, magazines, different things in your geographies. And then you've got your digital realm of your website, and what is it bringing in, and how do you manage all that information to see where the leads are coming from, how good those leads are, what your pull-through percentage of those leads are, what's your cost per acquisition per patient, right? If I'm spending $1 million in advertising a year and getting 10 patients, that's not great. If I'm spending $1 million a year and getting 1 million patients, that's fantastic, right? So you can't know all of those pieces unless you have a tool and a system that can manage all those different avenues and aspects of it. And most of the CRMs that I've seen that are add-ons to the EHR system they're just not built with the complexity that it takes to have all that information at your fingertips and to be able to analyze it in a way that is useful or meaningful.
Well, two things that we're missing is that, number one, it gives you the capacity to have a feedback loop with the patient. So it empowers the patient to have access to you, which they don't usually have. They have to go through the HRM department, and that's a whole headache. And having that information available to them at their fingertips, or even a way to send requests or be in the loop on what's going on with them, empowers them to feel a lot better about the whole process and the organizations that are delivering healthcare to them. That CRM does that like nothing else.
Yeah, and I think, from my perspective as someone that has worked in marketing for a while, and the CRM is generally as a part of marketing, right? It's an engine that can power a lot of the marketing that we do. And the idea of personalization, right? Personalization is personalization in your communication. It's the kind of thing that motivates people, right? It motivates an existing patient in terms of adherence, maybe. It motivates a potential lead in terms of understanding maybe the urgency of getting treatment. And it always works better when it's more personalized. And I've always found like that's kind of what a CRM is really good at, is taking that data. And I know, Charles, when you and I were talking before the webinar today, you talked about putting that data to work across the entire journey, right? Which starts as a lead and then continues through as a patient. So I want to shift gears a little bit right now. I think, Vibeke, we're going to skip poll number 3, and I just want to go into really the meat of the conversation today, which is exploring with our panel here, what is possible in terms of when you have a CRM that's configured properly and an EHR that are integrated together. What's possible to happen there? And we've talked about a couple different pieces of this, about insights and better automation and personalized communication and all these things. But what I really maybe like to get a sense of from Charles, from both you and John, is what do you feel like has been the most impactful thing that you've seen, to a practice, to your practice, or to practice that you've worked with before, in terms of what you got out of having a fully operational CRM that was integrated with an EHR?
The most impactful thing I would say is that you have the capacity to have analysts who can build patient profiles based on a disease or a condition, right? And when you build that profile in that CRM, you can build reminders and things into it and analytics into it to be able to pull data from the EHR that's relevant to the patient, that you create that communications of reminders, you create that communications of follow-up, you create that communications of predictive things that you'll have them, and create journeys for them to improve their ability to sustain and manage their chronic illnesses. So if, for instance, heart failure, A1C for diabetics, creatinine for renal patients, all types of reminders and education. So it has the capacity to educate, follow up, and predict. And if you can get on top of the educational piece and put more of the power and the transparency about the patient's current condition in front of them, it usually improves their interaction with facilities, compliance with treatment options, and it makes their life a lot better from a wellness perspective.
Excellent, Charles. What we've been able to do with our CRM system is to really spend the time to analyze our cost per acquisition, our spend in different areas. So in digital, we've been able to really look at the areas that people search on to find us, and stop using tools in areas of the internet that didn't drive business or volume to us, and save spend there and spend it in other areas where it's actually getting the phone to ring and get people to find us so that we could get them into the care that we provide. And then from a business development standpoint, we've been able to look at the various channels that we have desired to spend time in. So for us, it may be EAPs, it may be veterans accounts, it may be other treatment providers that we're making calls on. And so we can actually run reports to say, where are business development teams spending their time when they document their numbers of contacts per day, to the types of contacts that they make, and the way that they make them. So, maybe it was a text to this person, or a phone call to that person, or an email to that person, and a face-to-face visit to this person. We can segregate all of that out and look at it by salesperson, by channel, and then we can say, what's the most effective use of our time in our business development team's life cycle to generate the volume that we need to be successful. How far from our location? What is the distance that we can convince people to come to our site, and actually get them to continue to come back to that site? If it's too far, then they're not going to come on a regular basis. And that's obviously different for inpatient versus outpatient, but even how to set up our service structure. How many outpatients do we need around each inpatient facility based on where those patients are coming from? We actually at one point pulled our CRM data in and used the addresses of the patient homes and plotted out, where do our patients come from? What's the average distance to our location? So again, you're never going to get that kind of information from an EHR But the right CRM set up and established the right way, you can look across all these channels and all the money that you're spending to grow your business and to bring patients to your care, and look at it in that way.
And
So John,
sorry, just to also add, and something that Dr. Charles mentioned, I think it's a really beautiful way of saying in a very simple manner that CRMs and EHRs together can help let the patient know that you care, right? It's making sure you're looking at different data points from treatment that can be bought and automated and personalized using CRMs to reach out to them and say, every morning, first thing 8 o'clock, you're going to get a message from your facility saying, hey, just a reminder, here's what you need to do today, as per your last session with the doctor, or just letting them know that, this is how you can keep your diet better. You can eat better. You can feel better. I think it all comes down to making sure that there is a very automated or personalized outreach being done on a continuous basis. So I think the best way to look at how CRMs can complement EHRs is patient acquisition, ongoing care and engagement, and patient retention. Right. I think it sums up a lot of the different moving parts that can be brought together. And at the end of the day, all you're looking for is better patient experience.
And
yeah,
so, sorry. And so subconsciously, they start to, when they see any communications from your CRM, that's an information source for them. And they tend to start to look at that information. And over time, that automatically comes, that's not something that they will dismiss. That's not a message that they will delete. They'll look at it and read the content of it. So regardless of what it is, they're going to look at it just because they've gotten into the routine of getting information, and very relevant information to them from the CRM.
So John, I wanted to follow up with one item, kind of what you were talking about a little bit in terms of some of the insights that having a CRM has brought to your practice. It makes me think about some of the KPIs and measurements that, like, clients we work with that have a CRM have allowed us to enable, right? So for one of the KPIs we look at really for a lot of our clients is that lead to OV percentage, right? Like, it's essentially a measurement of how well your front office or a call center is doing at getting leads scheduled, getting them to be patient intakes, whatever. Do you have KPIs like that for your for the practice that you look at, or have you created kind of dashboards for some of those key things that you look at with your team on a regular basis?
We absolutely do. We have a number of different dashboards that we look at, the conversion percentage in total from total, new leads to admission. We look at the speed of that as well, as you said. And what really, as I said at the beginning, we have 26 locations, so we can look at that across locations, set a goal, as an organization that within an hour we'll get people scheduled. And what we've been able to identify, as the chief operations officer, is that some of our operations weren't as solid as we anticipated them to be, and they weren't as focused on getting new patients into their program as quickly as possible. So when you start to look at those things across an organization of that size, you can see some are just absolutely excellent at it. That's their focus, and some don't. And, that can either be a people problem, a process problem, but it gives you the visibility to say, how do you anticipate growing your location and your volume if you're not focused on getting those new patient leads to an office visit, to an admission, where we can start to actually provide care for that patient and generate revenue for that patient. So we have a tremendous number of dashboards that we look at daily, to track, census, length of stay, all those pieces. And a lot of that data comes directly from the CRM.
That's great. Charles, anything you wanted to add around insights, KPIs, reporting, that kind of data?
Yeah. KPIs for clinics, KPIs for emergency departments, door to doctor time. We track a lot of door to drug time for MIs and strokes, because we give them TPA. We need to be able to submit that kind of information to CMS for Medicare patients and Medicaid patients. So that's pivotal in what we're doing. From the clinic perspective, we do door to doc time and door to room time and things of that nature, and see how they correlate or crosswalk that with patient satisfaction scores, especially in hospitals that are in very affluent areas, because the tolerance for that is quite low. Patients aren't going to wait 2 hours for a doctor every time. They'll start transferring to other facilities or going to other doctors. So it's really important for them to be able to capture that information, to be able to make sure you're maintaining that, because you're in a service, you're in a patient service area that the quality of the service is also graded by CMS as well. So those satisfaction scores go into your reimbursement.
Yeah, I think part of what I'm hearing is, there's also a combination of like reports that you have access to, but then it also sounds like, John, you were talking about like a geographic area, or, Charles, I think part of what having a CRM and an EHR connected allows you to do is, when you have a more open-ended question, you've got a lot more data to reference or cross-reference or, segment in interesting ways to help kind of give insights to a question that you have, or to learn something maybe that you didn't know about your patient population, right? I wanted to talk a little bit about automation. So we haven't really talked about this a lot, but I'd love to get both of your perspectives on this. But one of the benefits I've seen with the practices that I've worked with is because the CRM is built on data, and you can build, triggers and workflows that are based on, what a potential, like a lead or an existing patient is doing, right? Oh, they visited the site again and looked at some data. Let's trigger an email or those kinds of things. One of the benefits I feel like I've seen is it allows you, the kind of automation, especially in communication, allows you to be faster in terms of your communication follow-up, to speak to more patients, to, we often talk about, like with the front office, it kind of empowers the front office to do more, right? To not be as kind of time constrained. Talk to me a little bit about what role maybe you've seen automation play.
Well, Charles has mentioned the patient journey once they're in the care, receiving care, and starting to communicate with them about diet, about medications, about those types of things onward. We've used our patient journeys to continue to help get people into care. For substance use disorder, a lot of people, may wake up the morning after a bad evening and decide, hey, I need to maybe make some phone calls, figure out what I need to do here. As they go through the day, maybe they get less and less motivated to be into care. So they've called us. We work through everything to try and get them into care, again, whether that be inpatient or outpatient. And they, kind of ghost the system, right? They think, okay, I've got this. I don't really need that help. So what we've done with our patient journeys, by drug category, by age, we have built communication timelines with people that reach out to them in a certain time period and say, hey, we're just checking in on you to make sure that you're, doing okay still, right? So the system either prompts a person to make a phone call, or the system sends an email or a text, whatever the preference was for that person when they initially contacted us. And, we will see a lot of patients that don't come to us for a full year after they've made that first phone call, because they didn't, they thought they had it. And after a year of time of ongoing substance use and issues created by that, they decide, hey, I want to absolutely go into care. So that automation that we built triggers that over time, versus somebody, again, having to go through and say, well, how about we call everybody that called us in the last 30 months, let's go pull a report and we'll print it out and hand it to 5 people. This automates that and does it. And once a person says, through that, either email or the other, yes, I'd like to, it goes directly into our call center. and we connect with them, and we start the process of getting them into care. So that automation has been huge for that process. Same with business development. It's real easy to get a team of people excited. They go out and they find a new account that says, oh yeah, all of our patients have this issue. We serve patients, pregnant females with substance abuse issues. So we call on a lot of OBGYNs, birthing units, and different things like that. And so they may go out and find out, 25% of our patients represent some type of substance use disorder as they come into our care. And we occasionally make referrals out to that. So they come back, they're all excited. Hey, we've got this great account. They're super excited. Well, the next day, hey, I got this other great account. The next day, I've got this other great account. And they don't, they go to where they think their greatest opportunity is, but maybe they don't do the follow-up with that particular great account. So you can build your CRM system to automate that after, you open a new account in the system, after 7 days, it either triggers the business development person, hey, what's your follow-up to this new account you created? Or it can send an automated message to the contacts in the account to say, hey, it was great to meet up with you 7 days ago. We want to continue to meet and build, this relationship to care for the people that you have in this area and have this need. So that automated prompting helps people to build better, consistent accounts versus just, hey, I woke up this morning and I wonder what my focus is going to be today, which direction I'm going to head, who I'm going to call on, and go from there. So I think it provides that opportunity.
Yeah, it's great, that idea of kind of enforcing maybe some of those standards that you have in terms of communication, timing of it, or even, the nature of the communication itself, right? Being able to build some sort of template that has the voice and tone and, all those kinds of things that you want. Charles, any other thoughts on automation?
One of the cool things that we've done, or in the process of doing, optimizing, is that we build profiles. We'll extract profiles from the EHR, and we will pull diabetes, hypertension, and renal failure, right? All three of those diseases affect each other. If you got diabetes, you're going to have high blood pressure because your blood viscosity changes, right? It's like glass going through your bloodstream. But we build these profiles into the system and create journeys for patients that gives them reminders to follow up with their nephrologist, to follow up with their cardiovascular guy, right? To follow up with their endocrinologist, as well as their PCP, making sure they get A1Cs done, making sure they get those serum creatinines done, making sure they have blood pressure monitoring at home, and making sure we get that documentation on at least a weekly or a bi-weekly basis to make sure that they're maintaining a good blood pressure, because that blood pressure is going to destroy their kidneys along with the diabetes. So it has to be a myriad of things and informationals that we're able to put automation into, send reminders, send education when it's available, and this stuff just pops off, and we can communicate directly with the caregiver to make sure that they're in compliance. So those things going automatically, from me taking 10 minutes to build a profile in a system and extract data, saves me hours of manual work, hours.
Yeah, it's great. I think it also, I think, is a pretty good reminder that, again, just because you have a CRM, you have to configure those messages. You have to build those segments, right? You really have to put it to work. And I know I saw a lot of people in our first poll said, I saw a lot of Salesforce people in there, right? And Salesforce is something where, it's very common for me to run into practices that are using Salesforce or using existing CRM. And a very common complaint that I hear is, we know we could be doing more with it, but we just haven't built it, or, we need a third-party developer to help us do X, Y, or Z, right? To really extract kind of the power that you need out of that. So I want to do one last poll that we've got, Vibeke, about patient expectations. So one of the conversations that we had preparing for the panel discussion today was about how our patient expectations may be changing. And I wanted to start off maybe having John talk about this, because I noticed, John, on the Virtava site that you guys have a pretty prominent call to action on the site for people to reach out via text messaging for help. And this was something I think we saw even with Nick's slide at the very beginning, the idea that now patients are reaching out to us via email and submitting forms on the site and downloading things and texting. Talk to us a little bit about the text message piece of things and maybe how that works inside of your CRM system and a little bit more about your experience there.
Excellent. No, happy to. So it's a good question. When I first got here, everything was focused on making the phone call, right? Pick up the phone, call us. Here's a number. You can click on the link and it will dial the number from your cell phone and talk to us. Well, what we found is a lot of people, especially when they're under the influence of alcohol or drugs, don't necessarily want to talk with you to demonstrate just how intoxicated they are on whatever it is that they're on. And so we found that a lot of people wanted to text. We also, shortly after we added the texting, added chat bots because people are more willing to, when they're inebriated, to be able to take the time to fashion a message in text or in a chat bot, kind of reread it versus getting on the phone and maybe slurring through a conversation. In this day and age where the bulk of people with this issue are 18 to 25, that's their sole means of communication is texting, right? We've had a number of patients tell us after the fact that if they could have gotten through the process without ever having to speak to a human being, they would have been much happier, right, with the process. So it's just that it's the mechanism that the youth are more comfortable with, using all the emojis and all those things versus having a true conversation around it. So the automation of texting, chat bots, and our patient journeys, all while trying to do that from a HIPAA compliant standpoint. Again, if your EHR is built out a CRM that they've home built and they're not used to using it to contact and create outside of the system, it's all been kind of easy to contain in a HIPAA protected world, just from providers and provider access. They tend to not want to open those floodgates, right, of patient access into there, and it's just not their expertise. So most CRM providers, are saying, hey, we've got to keep this HIPAA compliant, but we've got to create this avenue to be efficient for the provider and efficient for the patient to utilize. And that's definitely been an experience that we've had. And again, with that data, we can track our call center employees, how much contact they had with a patient, how many came in through text, how many came in through phone calls, how long are their phone calls, how much downtime do they have, how many people do we need on shift at this particular time? And that's all data that a CRM would provide that an EHR provider who's focused on medications and documentation isn't going to spend the time to really develop completely out for us.
Yeah, the example I often talk to practices about is there was a case of a hiker that got lost in the Grand Tetons National Park last year, and the police were calling him on his phone, and he was ignoring the calls because they were from an unknown number, right? And I think it just gives you a little bit of a sense of what we've seen with a lot of front desk and call activity, right? Is you have to call a lot, you have to call at different times, to be able to reach somebody. And I think one of the really powerful things we've seen automation with a CRM do is automated lead nurturing, right? So automatically texting and emailing and, getting this cadence out there to help the front desk connect with patients, because usually the number one reason that those leads fall through is just, hey, I tried calling and couldn't get in touch with that person, right? And sometimes it's just as easy to text and say, hey, what time works the best. Yep. I know we're getting close to kind of the Q&A section. So for anyone who's attending, if you have questions for Charles or John or Nick or anyone on the panel, go ahead and drop those in the chat, whether they're just general questions, topics we haven't addressed, or specific questions, right, that you might have for one of the panelists. In the meantime, one of the questions that I wanted to ask Charles and John while we're getting some of these questions fielded from our attendees are, one of the really powerful things you can do with a CRM is integrate into a lot of other technologies. So one of the questions I'd have for both of you is, are there some particular tools that you found, types of tools? I know, John, you mentioned, web chat. Are there certain types of tools that you've been able to integrate with your CRM that you found have been particularly good at maybe engaging with an existing patient or with a patient lead?
Yeah, so one of the big ones we had was a company called Actify. And Actify runs that patient journey we were discussing, that depending on the type of diagnosis and age, we tell them, hey, this is a lost lead. We've been, reaching out to them for, weeks. And it's a lost lead because they didn't have insurance or because they weren't motivated into care. And then they run that patient journey where they reach out over certain times to that patient. And if they get that patient engaged back in conversation, we pay them a fee. But our integration with them was extremely smooth and easy through an API. I think somebody mentioned an API on here. That data just automatically gets downloaded to them to fit into their process and what they've built. So that integration has absolutely been excellent. The texting feature comes from a company called Avocado, which is, again, is a HIPAA secured group. And the integration that we built there allows us to, the text messages come right into our call center. So it may not be the person who engaged the text conversation with them. Maybe they're on the phone with another patient. So it gets moved around until someone who's free can interact with that patient and continue that process of HIPAA secured communication to engage them at what time, 24/7, 365, that they want to be engaged with us and help to get them into care. And truly, through that process, we're saving lives, right? Like people, I can't tell you the number of times that people make an initial contact, get us connected with their family. We're working through the process and they don't make it into care because all you have to do is read the newspaper 3 days out of the week and you see, information about the fentanyl crisis that we have, the heroin crises that we have, and people die. They absolutely die when they're seeking to get into care if you can't get them in fast enough. So it really drives our teams to drive efficiency and effectiveness to get people into care when they first reach out, so that we don't lose people.
Great. Charles, any tools that you kind of want to call out, or types of tools?
The texting tools are just phenomenal because we're able to actually group members of people for the patient. That way everybody gets to text at the same time. So for instance, doctor's appointments and things of that nature, or reminders to do certain medications that are only given once a month, lab tests, rides, if they're picked up for rides for dialysis, it gives us the capability to communicate with an entire small ecosystem for that patient, all in one text, and it all comes directly from the CRM, and their responses come back into the system. So that's another just fantastic feature that we love to use.
Yeah.
Hey, John, I'd like to address Sylvia's question that she put in the chat. Mark, how do you figure out how to manage all these marginalized populations? And this is where I think Nick commented in the beginning. It's not just having a CRM, you have to have it set up correctly. And so when you think about all these different groups that you've listed out here, the elderly, the recovery, the IDD, TBI, SPMI, behavioral needs and physical challenges, if you have different channels or different locations that those patients are served, you have to track the calls coming in for those locations separately so that you can identify how quickly. It kind of goes to what I said about having 26 locations, and we could see maybe where we weren't as efficient or as effective as we wanted to be in some of those locations because we now have this data. So you need to make sure that if you have different phone numbers for those, different access points for those, that they're set up separately in the CRM. They may come into the same point of a call center or or they may go to a different desk at different parts of your facility or different facilities, but you've got to have that set up and established correctly so that you can identify and single out those data points and really be able to get the information that says, how many calls are we getting? How many of those are turning into office visits? How many of those are turning into admissions? Is it the person that's a problem, or is it a process that's a problem to generate a slowdown or a negative growth factor in my business in any one of those areas that you've mentioned?
That's great. Yeah, John, I was just gonna say, John, like that was going to be my tool recommendation, was specifically the call tracking and the tracking piece of things and having that set up correctly. Because I think, for every practice, you should know how many calls am I getting, how many of them are existing patients versus new patients. And I think you bring up another really interesting piece, which is it's multiple components, right? You have to have the right CRM platform. It has to be set up correctly, but also has to be used correctly, right? And oftentimes, like, in Sylvia's question, right? If you need a person inside of the practice to tag an individual as TBI or something else, right? They also have to do that. So you then have all that operational data. Go ahead, Charles.
If the first thing I would do is do a crosswalk of what information is available in the EMR based on that particular condition or that population of people that she's looking at, and crosswalk that to the information I want to communicate to them. What is it that I need to know about them from a clinical perspective, and what am I trying to communicate to them? And once you build that marriage of where it is and how you facilitate that getting across to your CRM, that's where your analysts can build those information points out to make sure that that's getting to the patients based on the clinical need that they have.
Cool. So one of the last things I want to touch on, I know we just got a few minutes left, Nick, but one of the things that I wanted to ask was for Charles and John, if you have any pointers for the people on the call that are either looking for a CRM or looking to enhance maybe the CRM they have or looking to switch, like what's some general kind of advice or tips that you might give to people on the call that are going through that search?
Go ahead, Charles.
Go ahead.
After you.
Take your time, and the team that you work with will give you a real good indication of what they're going to do for you post-sale. That's the most important thing. When you sit down with them, are they really listening to your needs, seeing what you're trying to accomplish? What are your objectives? And that relationship, that energy you get in that meeting will determine whether or not you should go forward with them. That's the most important thing, because I can tell you now, you can get a great salesperson that'll come in and the service after the sale is horrible. So you make sure that that person that's sitting down with you is really addressing your needs, listening to you, allowing you to vet, giving you recommendations, and trust your gut on that judgment. That energy that they're giving you is going to tell you how it's going to work out.
Charles, you couldn't be more spot on. That is a huge thing to look out for as you're searching for this. The other thing is, it's not just the actual cost of the system, it's the cost to run it afterwards. So, the first poll question was, do you have a CRM? Is it Salesforce, right? So I can just tell you, I've used Salesforce in the past. The system itself is very expensive, but it is wildly expensive to manage it after the fact. You have to have a programmer. It's not, your secretary in your office cannot make adjustments to that system and manage it that way. You have to have a Salesforce certified programmer at $125,000, $130,000 a year salary. And there's only so much they can do. So if you want to build it out certain ways, you may have to have two of them. So I just think you need to look at the actual cost of the system, but then the cost to manage and run the system how user-friendly is it for data reporting, and how user-friendly is it for you to set up?
Awesome. Well, I know we've only got a minute or so left, so I didn't know, Nick, if you wanted to have any closing statements or anything like that.
Yes, I want to tell everybody on the call, come take a look at LeadSquared. We'll solve all your problems. But that's just me giving you the last 30-second sales pitch. But I really appreciate John and Dr. Charles for joining us on the panel today. I think your experience, your opinions, your suggestions, your knowledge I'm sure has not only benefited me, but everybody else on the panel as well. Just to understand how they can manage two technologies together to get the most common outcome everybody in healthcare is looking for, is better patient outcomes and patient experience. So I really want to thank everybody, and thank you so much, John Keeler, for moderating this for us, and always being open to participating and doing this with LeadSquared. For everybody else who's on the panel, who joined us today, please feel free to reach out to anyone at LeadSquared, anyone on the panel. If you have any questions, we'll be happy to get them answered. And finally, thank you so much for joining us today. We look forward to many more such conversations with many more panelists in the coming time. Thank you, and have a great day.